the free flow of air when you're sleeping. So the photo on the left here with normal breathing, you can see the arrows and the pink spaces. This is your airway that's nice and open, so airway can flow freely. And when you have an obstruction, either the back of the tongue or sometimes the soft palate, the upper back part of your throat can collapse down on your breathing tube, your airway, and cause an obstruction, a mechanical obstruction in the blood flow. And as you can imagine, if you're trying to move air through a tight obstruction, you can get noise. And this is the type of sleep apnea most commonly associated with snoring. Central sleep apnea impacts a much smaller percent of the population, a much smaller percent of all the people who have sleep disordered breathing. However, as we'll talk about as we dive into the heart disease piece of this, it does impact people who have heart failure or some heart arrhythmias much more commonly than it does the general population. In central sleep apnea, it's actually a disease process where the signal from your brain down through your nerves, your phrenic nerves, to your diaphragm and breathing muscles is lost. So the signal that just goes there without you even thinking about it to tell your diaphragm and your other breathing muscles to breathe on a regular basis is not there. And when patients go to sleep, they stop breathing because of that loss of signal. So sleep apnea can cause both daytime and nighttime symptoms. I think one of the biggest misconceptions, and this is a passion that Laurie and I share for sure, is people think if you have sleep apnea, it simply means that you're tired during the day. But from a symptom standpoint, it can be far worse and much more impactful. Everything from forgetfulness, poor concentration, headaches, just feeling bad all the time, being cranky and irritable. And, we'll talk about what that means, from a physical or health standpoint as well. So if sleep apnea is not treated, it can lead to a lot of known diseases: heart failure, some heart arrhythmias, diabetes, depression or mood issues, dementia, concentration, and even high blood pressure. And I like to start there because then we're going to dive into the next slide that talks about the risk factors for sleep apnea. And if you'll notice, the first 4 of these are cardiac issues or heart problems. So it works both ways. And like I said, I call this a two-way street. Sleep apnea, when it's not treated, can cause all of these heart issues. And these heart issues can also make you at higher risk for sleep apnea. And so it's like putting a puzzle together. If you don't find all the pieces, then you won't have the complete finished picture. And you can think of your health as that way too, I think. So let's dive into these. So how common is sleep apnea in patients who have various types of cardiovascular disease? And we'll dive into some of these specifically in just a few more slides. High blood pressure, hypertension, very common, particularly if you have to take multiple medications. Congestive heart failure, diabetes, strokes, and various types of abnormal heart rhythms. So let's talk about high blood pressure first, because this is one of the most common diagnoses for Americans. High blood pressure affects many people in this country, and the intersection between high blood pressure and sleep apnea is pretty well documented in the medical data. So sleep apnea is an independent risk factor for high blood pressure. And if you look at the 2 bullet points under that, 60 to 80% of people with obstructive sleep apnea have documented high blood pressure in their past medical history. But about 40%, so not quite half, of all people with high blood pressure also have concurrent sleep apnea, and many of those are not treated and even not diagnosed. But if you look at people who are on 3 or more medications to control their high blood pressure, what we call resistant hypertension, that number goes to about 90%. So if you need 3 or more medications to control blood pressure, about a 90% chance that you have some sort of sleep disordered breathing. Atrial fibrillation is a very common abnormal heart rhythm. Some people call this an irregular heartbeat. It happens when the top chambers of your heart, or the atria, instead of having a nice, consistent squeeze, instead have a quiver where the blood doesn't flow smoothly through the heart. A lot of people with atrial fibrillation have faster heart rates as part of the arrhythmia. And it's estimated, depending on what literature, what research study you look to, that between 50 and 80% of people who have atrial fibrillation have sleep apnea, some sort of sleep disorder breathing. Most of those will have obstructive, but about 20% of those will have a sleep disorder breathing that's predominantly central, where that signal that I talked about is lost to signal the diaphragm to breathe. But also, again, two sides of all these coins, if you have untreated sleep apnea, it's been shown to significantly increase your risk of developing atrial fibrillation down the road. And furthermore, I'll show you in a couple of slides that there are a lot of research studies, a lot of data to say that treating sleep apnea will improve all types of treatment for atrial fibrillation. So this is a pie chart showing a study looking at two groups of patients who had atrial fibrillation. The group A on the left side in the red are people who continued to use their CPAP after 1 year. And then group B, patients who stopped using their CPAP, They looked at these patients a year later. And as you see, group A, the big piece of the pie chart here, 76% of them stayed in a normal sinus rhythm. A sinus rhythm is a normal rhythm. And 25%, so about 1 in 4, just under 1 in 4, were back in atrial fibrillation at the 1 year mark. But look at group B, the patients who stopped using their CPAP mask. 65% of them were back in the abnormal atrial fibrillation, and only 34% remained in a normal rhythm. So wearing CPAP treating sleep apnea has been, in several studies now, shown to improve treatments for atrial fibrillation. What about other heart arrhythmias? Laurie and I were talking about this before everyone signed on with abnormal heart rhythms, particularly those that happen in the middle of the night or lead to sudden cardiac death. And several other abnormal heart rhythms have also been associated with sleep apnea and vice versa. Sleep apnea lends itself to these arrhythmias. So ventricular arrhythmias are abnormal heart rhythms that lead to sudden cardiac death. So you see on the television, someone collapses and they get the defibrillator or call EMS, call the paramedics, and need that shock. Those are typically ventricular arrhythmias. And you may know people who have an implantable defibrillator that looks very similar to a pacemaker that can shock the heart if needed. And those are patients who have a risk of having these types of arrhythmias. But again, patients with sleep apnea who also have heart failure, twice as likely to have one of these arrhythmias and receive or need a shock. And then sudden cardiac death at night, twice as likely in patients who have sleep disorder breathing, any type of sleep apnea. And then slow heart rhythms, pauses or heart blocks, where you may need a pacemaker to kind of signal your heart to beat, also much more common in patients who have sleep apnea if it's untreated. This looks at specifically heart failure patients. And again, this is a group of patients that I spent many years treating and educating and trying to help give better lives. And the pie chart kind of shows the breakdown among heart failure patients of sleep disordered breathing or any kind of sleep apnea. 75%, so 3 out of every 4 heart failure patients will have some sort of sleep disorder breathing. And in heart failure, they could have either central sleep apnea or obstructive sleep apnea. And honestly, it doesn't matter. The goal here is to really identify this so that the sleep disorder breathing can be treated. And it's confounded by all of these bullet points over on the right side. Many patients with sleep apnea feel tired, they get admitted to the hospital more often if they have heart failure. They get up a lot at night to go to the bathroom. They wake up a lot at night and they're not sure why. They have memory or thinking difficulties. They can't remember what they, why they went into a room. And a lot of these things are things that we tend to just dismiss. That's part of my heart problem. That's part of my heart failure. And they don't really make the link between these symptoms and sleep apnea. But we know that patients with various forms of sleep apnea who have bed partners frequently are told that they snore at night, or they stop breathing at night, or they gasp or pant at night. And a lot of times the patients themselves aren't really aware of these arousals at night. They're just aware of how badly they feel in the daytime. So a couple more slides on heart failure that really make the point of the need to identify and treat sleep disorder breathing. This is a very clinical medical slide, but it's a really large group of patients studied and sponsored by the National Institutes of Health, showing that patients with, this is specific to central sleep apnea, but the data actually showed patients with any kind of sleep disorder breathing significantly more likely to be admitted to the hospital and then readmitted for heart failure problems. So untreated sleep apnea can result in more frequent heart failure admissions and fluid overload and decompensation of heart failure. And then the last slide here on heart failure, the blue line is obstructive sleep apnea, the red line is central sleep apnea, and the black line are heart failure patients who have no sleep apnea. And basically, again, very clinical medical slide, but what this shows is if you have any kind of sleep apnea and you have heart failure, you have half of the survival out to 3 years as if you had no sleep apnea at all. So put another way, having any kind of sleep apnea and heart failure makes you twice as likely to die at 3 years compared with heart failure patients who have no sleep disorder breathing. So pretty staggering statistics, again, not to be scary, but just to point out the need for treatment, for screening and identification. And I just have a couple more slides. This is a slide that we use for screening, just asking questions. Have you ever been told you stop breathing? Do you have trouble concentrating? Have you been told that you snore? Do you have a history of atrial fibrillation or heart failure? Or have you been told in the past that you have sleep apnea? There's a very common thought that if you had sleep apnea in the past, it can go away, and it can in some patients, but a lot of times we hear stories of patients who have been told they had sleep apnea in the past and dismissed it and didn't feel like it was an issue anymore. So any of these things are kind of red flags to make you take a step back and say, do I need a sleep study, a screening test, and how do I find a partner who in the sleep world who can do a test and treat my sleep apnea and work with me if I do have sleep apnea. And I'm going to leave you with one last set of statistics. So about 25% of all adults have some sort of sleep apnea, but 60% of patients with heart disease or cardiovascular disease have sleep apnea. And sadly, 85% of those are undiagnosed. So they're not being treated. They don't know they have the disease. So the take-home message, for this discussion is simply get tested, get screened for sleep apnea, and if you have sleep apnea of any type, get treated, because it not only makes you feel amazing and makes you feel better, but it can really impact the rest of your health. I think that's all, Lori, if you want to open it up for some questions.
All right. Thank you. It's true. I am a sleep apnea patient myself. And so if you guys want to hear more about my story and my journey, tomorrow night at 5:30, you can join us again and watch. You can sign up on valleysleepcenter.com/events, or you just click events up in the top right-hand corner. I will send this recording out to all of you. I want to say thank you so much for joining. Thank you, Missy, for a great presentation. Very, very well done, and really important for all of us to listen and hear.